Okay, well, welcome everyone to this Friday afternoon WiLSWorld short. We're really happy that you're here and really looking forward to spending the next hour with our speaker today, Barbara Alvarez. I'm so honored to introduce her. Barbara and I met last year through a mutual colleague, so I was really delighted when I saw her listed as Wisconsin's own library journal mover and shaker for 2022. You know, we gotta love that kind of home state pride, right? So a little bit about Barbara. She's an instructor in library and information science at 3 different universities. She is also a PhD student in information science at the University of Wisconsin-Madison, where her focus is on information access for reproductive health. Barbara is working on her second book about how public libraries can provide sexual and reproductive health information to their communities. I am really proud that we're here today exploring and discussing a charged issue through the lens of delivering good fact-based information. While I won't pretend to know how everyone here today feels about the various facets of this topic, I trust we're all here to learn and to grow and be respectful of each other. Barbara will leave time at the end of her presentation for questions, so please hang on to any questions you have. You're welcome to put them in the chat. We're going to keep an eye on that and kind of hold on to those, and we'll get to as many questions as we can at the end. So with that, I'll just thank Barbara again for being here today, and I'll turn things over to you.
Thank you, Jennifer, for the warm introduction, and thank you to Jennifer and the WiLS team, including Andy, for helping me get started onboarding me today for this presentation. I am just truly honored to be here in this space to meet with all of you and to talk about this really important and timely topic. So thank you so much for having me. My goal over the next hour, the time that we have together, is to tell you a little bit about myself and my background, how that led me to focusing on sexual and reproductive health information for libraries, and how that relates to the work I'm currently doing in the landscape that we're in. I will love to answer any questions or hear feedback from you, and I'll make sure that I leave some time to do that in the last 15 to 20 minutes of our time together. So let me just tell you a little bit about myself. I'm really honored to be a library journal mover and shaker for Wisconsin. This was just a huge honor for me to be nominated and selected for this. So I just want to tell you a little bit about what was put into that little bio in the magazine. So I have been working with sexual and reproductive health information for about 3 years as a PhD student at the University of Wisconsin-Madison. So I've worked on some research teams where we have done cold calls to abortion clinics in Wisconsin and surrounding states. This is prior to anything that's been going on now. This was at the very beginning of the pandemic, actually. And it wasn't intended to be a pandemic-based research. Originally, this research project was just to see how long it would take for somebody seeking an abortion in Wisconsin to be able to get an appointment in a surrounding state. So a little bit of context. Before Roe v. Wade was reversed in June of this year, there were 4 abortion clinics in the state of Wisconsin. The locations for those were Milwaukee, Madison, and Sheboygan. And I want to clarify that those clinics are still in existence. They just aren't providing abortion care right now, but they provide other types of reproductive and sexual health services. But in any event, there are 4 clinics in the state of Wisconsin, 2 in Madison, 1 in Milwaukee, and 1 in Sheboygan. So that means that anybody who lives in northern Wisconsin area would have to travel a significant amount of time to get to the nearest clinic. Sheboygan would be the nearest clinic for many people. However, they only provided medication abortion, not surgical abortion. And medication abortion is only available up to 10 or 11 weeks of gestation. So depending on how far along somebody is in their pregnancy, that location wouldn't be accessible to them. The other thing is Wisconsin had this rule saying that you have to have a 24-hour waiting period. So the first appointment is really a consultation with a doctor to explain what the procedure is like, and then you have to wait a minimum of 24 hours before you can actually get that procedure. Now, doing informed consent is typical for any type of medical procedure, but other states like Illinois or I believe Minnesota, they don't have a 24-hour waiting period for abortion. You have the informed consent, the consultation, and if you feel comfortable with everything and agree to it, you can have the procedure that very day, immediately. But in Wisconsin, you have to wait 24 hours. Now, in some states like South Dakota, you have to wait 48 hours. Some other states, 72 hours. So this is very specific to abortion, by the way. There aren't other procedures where you have to wait a certain time period. So the purpose of this research was to say, if in the event that Roe versus Wade is overturned, Wisconsin has an 1849 pre-Civil War law on the books that criminalizes providing abortion care. So where are people going to go? Now, I started doing these cold calls in surrounding states, Illinois, Minnesota, Upper Michigan, Iowa, at the exact same time that the pandemic happened. That I shouldn't say happened, but that it began, that lockdown began. So that started at the end of March. This wasn't intended to be a pandemic-based research project. It just happened to be. And so for about 3 months, I would do weekly cold calls to these clinics, about 29 clinics in surrounding states, just to see what the wait times were. And as I said, there were already some barriers in Wisconsin based on the limited number of clinics that there are, the mandated 24-hour waiting period. But the pandemic compounded that because in Wisconsin, we also aren't allowed to have telehealth appointments for abortion. Now, in other states, there was telehealth options, which means that you could at least have the initial consultation on the phone or Zoom, and then you could come in to the clinic for the abortion procedure. In Wisconsin, even though we are able to have telehealth appointments for all other types of medical procedures. For example, you could have a telehealth appointment if you have the flu, if you have a cold, if you think you have an STI, a sexually transmitted infection, if you need birth control, things like that. But to explain the process of an abortion procedure on the phone or Zoom, that is illegal. So this telehealth option wasn't available in the pandemic, and instead some legislators were trying to shut down abortion clinics, completely saying that they weren't essential. So this just really compounded the barriers that we're seeing, and it ended up being a little bit of a foreshadow for where we're at right now, because the purpose of this research project initially was to see what would happen if Roe v. Wade fell and where people would go, and we're seeing that right now. So you might be wondering, how did you even get into doing a research project about abortion if you have a background in library and information science? Where is this connection? So let me tell you a little bit about myself and my background. I have my master's in library and information science from the University of Illinois. I graduated in 2012, and I spent about 8 years in libraries in Illinois. I'm originally from Illinois. I worked in public libraries in the Chicago suburbs before my husband and I moved up to Wisconsin in 2016, where I then worked in a corporate library and a corporate archive before returning to my passion of public libraries. And I worked in the Milwaukee County Federated Library System before pursuing a PhD. I am very, very passionate about community engagement and always have been in every single area that I've been in libraries. I've worked in 5 different libraries in 2 different states, and as I said, it's been a corporate library or some public libraries, but wherever I've been, I've always been really passionate about the connections that librarians can build with their community, whoever the community is. So if you're in a private business, your community might be different business segments in that corporation, or if you're a public library, it could be different organizations or people in your community. Whoever it is, I'm really passionate about those connections between information providers and the people who are seeking information. So that's led me to have a lot of really great opportunities to teach webinars and online classes focused on marketing and communication and information access. In 2019, I began teaching on the university level for graduate students pursuing a master's in library and information science. And I've taught a little bit of everything from marketing to reference to administration and management. And in 2019, I decided that I wanted to, or in 2018, I guess is when I applied, but in 2019, I began a PhD program at University of Wisconsin-Madison. And I knew that I wanted to do something related to this community engagement piece of how librarians can work with their communities. Now, at the time, there was a 6-week abortion ban that was going down in, I believe it was Louisiana. And I have always been passionate about reproductive health and equal rights and feminism and things like that. And it's always been an area that I've cared deeply about. But I felt very triggered, for lack of a better word, by this 6-week abortion ban that was going down. Now, it was blocked by the courts, but it really signaled that this abortion debate, it's not a debate anymore. It's a place where real action and restrictions are taking place. And it's been going on for centuries, long before I was paying attention to it. But this really triggered something in me about, this isn't just about dialogue about pro and anti-abortion. There are things that are going down where abortion and other reproductive health services are being denied, and that is an information issue. So that's where I decided to focus. In 2019, when I entered the program, I really kept that focus on reproductive health. Now, I initially entered the program wanting to focus specifically on abortion and reproductive health rights in Puerto Rico. My family is, my dad's side of the family is from Puerto Rico, and Puerto Rico has a really complicated history with reproductive health. It is one of the highest, has one of the highest rates of sterilization in the world. About 33% of Puerto Rican women were sterilized by the 1970s. Birth control was tested on them. And there are also hardly any abortion clinics on the island. There's a lot of issues going on there with infrastructure. The Hurricane Maria happened in 2017, and I personally saw my grandma and my aunt live there, and they had to be evacuated. So I saw how devastating that could be on a familial level. And so I initially entered this lens of how are people in Puerto Rico sharing information about abortion when there are so many barriers to abortion access and abortion information on the island. However, I've since shifted to now more focusing on Wisconsin, because Wisconsin is actually experiencing something very similar. But regardless of Puerto Rico or Wisconsin or United States or anything like that, this is something that's happening throughout the entire country on some level, and has been for decades. So that's kind of where I'm coming from in my background coming here. But I also want to say that, as I mentioned, this is an information access issue. And I have written about misinformation and disinformation for several years. In 2017, or I guess in the 2016 issue of Public Libraries magazine, I wrote about the role of public libraries in the age of fake news and how public libraries can stand up to fake news. And last year, I wrote a follow-up piece to that about public libraries and dismantling disinformation. Now, this is where it becomes this intersection about reproductive health and abortion, because abortion restrictions are really persistent because of the role of disinformation and misinformation. And so I think that there is a lot of opportunity for public libraries to demystify fake news on all different types of levels, and that includes reproductive health. As I mentioned, I also I care very deeply about community engagement. So this is an article that I had published, or that I wrote and published, an academic piece in Penn State's Journal for Library Societies and Cultures. And it's just about the history of public libraries and community discussions. So I'm bringing all this in to show that there's all these threads about community engagement, disinformation, misinformation, and how that's kind of led me to this place of connecting that to reproductive health. One other thing I'd like to mention related to that community engagement piece. My first book I had published in 2016 with the American Library Association, and it's all about being an embedded business librarian in the public library. And so as I mentioned earlier, I firmly believe in community connections, community engagement, and I think that that's the best way that public libraries can move forward. As a business librarian in a Chicago suburb, I worked in a very embedded way with the local business community and was really outside of the library more than I was in it, and built up some strong relationships, some meaningful connections to help understand what was going on a real level in the business community and how the public library could respond. And I think that that's pretty similar to what's going on right now on a state and national level related to sexual and reproductive health and how the library can respond. So that was published in 2016. I've cared deeply about community health for quite a while. When I was at the North Shore Library in Milwaukee, I helped start one of the first memory connection centers, the first of its kind in the Milwaukee area, by doing a partnership with the Milwaukee County Department on Aging. And it was basically focused on helping caregivers for those with dementia and providing resources for them, educational opportunities, ensuring that staff were trained to work with dementia, folks who are experiencing dementia and their caregivers, so that we could become a dementia-friendly library, as well as create specific kits and resources for people that they could give to their loved ones who are experiencing dementia. And for this, the North Shore Library was awarded the Wisconsin Library Association's Programming Innovation Award. So community health is something that I care very deeply about, community connections in general, and the real power that public libraries can have on a local level to demystify health information, as well as to build trust between information providers and information seekers. So that brings us here to reproductive health. As I mentioned, I started doing this research while at the University of Wisconsin about where we would be if Wisconsin or Roe v. Wade was to be overturned. And that's only one piece of the puzzle. It's a very small piece of the puzzle about reproductive health and information. So I want to talk about why specifically this is an information access issue. There's a few things that I want to point out. First of all, the Library Bill of Rights, it states that we have an obligation to resist any efforts to exclude materials, including materials on sex, gender identity, and sexual orientation. Now, sexual and reproductive health information is something that is extremely important because this is how we help construct our lives. There's a concept called reproductive justice, and reproductive justice is a really important framework that was the term and the framework was coined by a group of Black women, activists, and physicians and reproductive health experts in Chicago in 1994 at a conference specifically about reproductive health. And reproductive justice says that this isn't all about being for abortion or anti-abortion. This is about creating a space where people can make the best decisions for themselves. So this means people have the human right to decide whether they want to have children, whether they don't want to have children, and to raise those children in environments that are safe and sustainable. That really breaks down this whole concept of, well, I'm pro-life, or I'm anti-abortion, or I am pro-choice or pro-abortion or things like that. That breaks it down by talking about reproductive justice, that it isn't this black and white issue, that it's actually about people being able to live in ways that are congruent with how they want to live. That includes bodily autonomy, and that also includes raising people in environments that are safe and sustainable. Now, people can't make those decisions without information. If they are denied information or they are straight up lied to, which we'll be talking about in a few slides, about reproductive health, they aren't going to be able to make informed decisions. And so that's why it's really important that libraries provide information about reproductive and sexual health. Now, to be clear, most people probably aren't going to come up to the reference desk and say, hi, can I have books on, on sex or something like that. I've actually had that a couple times where I've had somebody come up and point blank ask me for a book on sexual and reproductive health, but that's very, very rare. Most people are nervous to come up to the reference desk to begin with, and are much less likely to come up to the reference desk and ask for help on, contraception or something like that. Regardless, it's really important that we still provide the information in a variety of formats. Books, databases, pamphlets, whatever it is, because people deserve to have the access to the information that they need. But it isn't just about a library bill of rights. This is also part of human rights. So, for example, the United Nations in their Declaration of Human Rights, Article 19, specifically says that everybody has the right to freedom of opinion and expression, and this right includes freedom to hold opinions without interference and to seek, receive, and impart information and ideas. So I think that's really important, to seek and receive as well as impart information. The World Health Organization has also said that the sexual health and well-being is dependent on access to comprehensive and good quality information. So, as I've said a couple slides back, this isn't just about this isn't separate from what we do. This is an information access issue. This isn't just a medical or a health concern or community health. This is also about information access. And we have an opportunity to provide that information to our communities. Speaking of that, let's look where we're at in Wisconsin. So prior to the reversal of Roe v. Wade, as I explained a few slides back, we had state-mandated counseling sessions that added significant barriers to access. So that means that people had to travel all the way from up north or wherever they were to get to the nearest abortion clinic and have an appointment to explain the process. Now, that state-mandated counseling session then required a 24-hour waiting period. The thing about that 24-hour waiting period is that, let's say somebody does the state mandated counseling session. They say, yep, I'm ready. I want to do this. They say, okay, you have to wait 24 hours, but it has to be with the exact same doctor who you met for that counseling session. So just because it's 24 hours, if that doctor isn't clocked in the next day on the schedule, you got to wait the next time they're around and hope that there's an appointment available. So that could be another week. And as I mentioned, Sheboygan only provided medication abortion up to 10, 11 weeks gestation. So if somebody has most people don't find out they're pregnant till over 6 weeks of gestation. So let's just say somebody finds out they're pregnant, they wanted to get a counseling session in, the nearest appointment that they could get, because there's only 4 clinics in the state and abortion can only be performed at a clinic, not at like a family doctor or hospital or anything like that. The next time that they could get an appointment was in 2 weeks. Okay, that's 8 weeks now. Then let's say, okay, yep, I'm ready to do this. You got to wait 24 hours. Oh, but the doctor isn't on the books tomorrow, or they had to call out sick, or their kid is sick and they have to take their kid had to come home from school. So they had to cancel all their appointments. So that could be, depending on time, 9, 10 weeks. Now, 10 to 11 weeks is the limit for medication abortion. So then you would have to get a surgical appointment. Well, that's it. You got to go down to Milwaukee or Madison, and you got to do the whole counseling session all over again because it wasn't with that first person. So that's a lot of barriers to begin with. Now imagine somebody that lives far away from all of this, up north. They have children, they have to drive. I mean, this is gas, this is hotel, finding childcare, all of that stuff can be really cumbersome. So we had a lot of significant barriers to access to begin with. This isn't new. The fact that Roe v. Wade was reversed in June obviously it's made significant changes in Wisconsin, but people have been struggling for access for decades in the state. Telemedicine for abortion is illegal in Wisconsin, even though the Food and Drug Administration, the FDA, has said that it's safe. There are many states that allow telemedicine for abortion, and you can have an appointment online, do an intake with a doctor through telehealth, just kind of like what we're doing. You can have abortion pills mailed to your home. It's much cheaper, because the other thing with this whole state mandated counseling and then the follow-up appointment is that costs a lot of money. And in Wisconsin, that isn't covered by Medicare or Medicaid or any state funded health. That's a result of the Hyde Amendment, which has been around since the late 1970s, early 1980s, where anybody who is on public health insurance, and that includes people who are in the Indian Health Services program, people who are in the military, people who are in the Peace Corps, people who work for the government, things like that, that their health insurance will not cover abortion. Each state can individually decide whether or not that they want to put money towards that. So some states like Colorado will say, or Illinois will say, okay, even though this isn't covered, we will put money, our state will put money towards this. Wisconsin doesn't have that. So this would cost, in addition to all that time that we're talking about, this would cost about $600 to $700 for somebody to have an appointment in the first trimester, which is when over 90% of abortions occur within that first trimester. So anyway, telemedicine isn't available, even though that could reduce costs down to $75 and change wait times, things like that. The other thing is Catholic hospitals run about 1/3 of hospitals in Wisconsin. Many of these are in rural and urban areas. And you might be thinking, well, so what? Who cares? And on its face, that's really not an issue, except for the fact that studies have shown that many do not disclose their religious directives. And those religious directives are that they do not provide abortion care, they do not provide contraception, they don't do sterilization, things like that. And many people simply are unaware. And so they'll go to the nearest hospital, which could be a Catholic hospital, simply because that's what's closest to them, especially if they're in a rural area or in an urban area. And they just simply aren't aware of the breadth of what the hospital provides or doesn't provide until it comes to the point where they ask for that service and then they're denied it. That's a big issue, especially because Wisconsin has a very high maternal mortality rate for Black women in this state. Black maternal mortality is high throughout the entire country. Wisconsin has one of the highest rates. In fact, it's 5 times higher in Wisconsin. Black maternal mortality rate is 5 times higher in Wisconsin than white mortality rate. And that also means that Black infants risk death at double the state's average. So that also brings us to the fact that in Wisconsin, we have nearly 100 crisis pregnancy centers. Crisis pregnancy centers, or CPCs, are fake clinics. They pretend to have information and comprehensive information about reproductive health, but they're actually rooted in trying to dissuading people from choosing an abortion procedure. And many of them don't even provide contraception or don't even advocate for contraception. Many of them are religious based. I believe studies have found that over 90% of them are religious based. And so while they might not say that on their website, their funding is coming specifically from churches and things like that. And so that might reflect the religious perspective, the church's perspective of premarital sex, of abortion, contraception, and things like that. Now that's an issue because in Wisconsin, we no longer have clinics that are providing abortion care, but we have nearly 100 crisis pregnancy centers. Those crisis pregnancy centers have been receiving millions of taxpayer dollars. In my own community, I think there's about 4 or 5 billboards advertising a local crisis pregnancy center. And that is an information access issue because many of their services are not founded in science. Many crisis pregnancy centers lack any person on staff that actually has a medical license that has a medical license, and they are able to get around that because they aren't medical facilities. So they are able to get around it because of freedom of speech. A California Supreme Court ruled that they are protected by the First Amendment because they aren't a licensed medical facility. So they can get around it through freedom of speech. However, they masquerade as a legitimate healthcare center and often will promote abortion reversal pills. Again, in my own community, I've seen billboards saying, taking the abortion pill, it's not too late. And call us about the abortion reversal pill. The abortion reversal pill is not founded in science at all. Research studies have had to stop the abortion reversal pill. There were some studies to test out an abortion reversal pill, but they had to stop because over 1/3 of participants had to go to the hospital from it. So they seized the study, and there is no conclusive evidence that abortion reversal pills are effective or that they work or that. And instead, they can actually cause harm. And so the American Medical Association, American College of Obstetricians and Gynecologists, all major medical associations and organizations have called abortion reversal pills to be fake science. And yet CPCs still promote them. The other thing that I want to bring up that's an information access issue is sex ed. Only 17 states require that sex ed be medically accurate. Wisconsin is not one of them. That means that sex ed doesn't necessarily have to reflect evidence-based science, and also it doesn't necessarily have to be inclusive to LGBTQ communities or to talk about abortion options. So these are all of the things that we are seeing in Wisconsin that lead not only just to barriers of reproductive health, but when we're talking about reproductive justice, barriers to information access. So that's what I really want this takeaway to be, is that it's not just about reproductive health services and being able to get an abortion or to be able to get a contraception or, find out about having your tubes tied or anything like that. It's not just about being able to get those services. It's about being able to learn about those services and get the information about them. And we're seeing right here in Wisconsin, sex ed doesn't require it. We don't have abortion clinics that can actually talk through this. Instead, we have crisis pregnancy centers that will spread disinformation about these services and actually tout abortion reversal pills, which aren't rooted in science. We have 1/3 of hospitals that are Catholic that straight up don't provide these services, but also not just providing the services, don't disclose that they don't provide those services or explain where people could go to get them. We don't have telemedicine for abortion, where people actually could have the opportunity, especially if they live in the rural area or they're very low income and can't travel out of state. That telemedicine could give people the opportunity to get that information and services from another state and have it mailed to them. We don't have that. And we haven't had it for quite some time because, as I said, we've had some state mandated counseling that has significant barriers to access. The other thing that I want to add about the state mandated counseling is that in many states, this isn't relevant right now to Wisconsin because abortion isn't being provided in Wisconsin right now, but in many states, state mandated counseling centers also aren't medically accurate. Legislators will mandate doctors to say to patients, abortion will cause cancer. This could make you, could cause infertility. You could have psychological distress from this. Doctors are mandated to say that even though there is no scientific evidence that abortions cause infertility, are linked to breast cancer. And in fact, studies have consistently found that around 99% of people that have an abortion don't regret it, they feel relief. The Turnaway study is this landmark study that came out recently that studied about 50,000 people throughout the United States that were either received an abortion or were denied an abortion because of the barriers to it. And this study then tracked how people were doing afterwards, years afterwards, after either having a wanted abortion or being denied a wanted abortion. So this is a wanted abortion. And the study found that the people who were denied were more likely to stay in abusive relationships, were more likely to experience domestic violence, were more likely to have long-term health difficulties, and were more likely to be living in poverty. So again, this isn't just about getting the service. It's also about getting the information to make the decisions for those services. So I worked on some other research that talked about, that really focused on medication abortion. As I said, in Wisconsin, we don't have telemedicine as an option for medication abortion. Other states do, but Wisconsin doesn't. And some research that I participated in found that medication abortion is really a helpful alternative or option for people that are seeking an abortion, but they want to perhaps they don't want to have the procedure in a clinic. They want to do it at home. Medication abortion, without getting into details, is taking pills. And many people would prefer to do this at home because it might mimic more of a miscarriage. It might feel more natural to people. They want to be, in their home where they feel safe. Whereas other people, we found, may choose surgical abortions because their home isn't a safe place. They want to keep this private. But regardless, we found by reviewing Reddit, excuse me, let me go back. By analyzing Reddit pieces, there's a forum on Reddit where people were posting about whether or not they want a medication abortion or whether they should choose a surgical abortion. That this is people were turning to Reddit for information from other people throughout the country and throughout the world about which option they should choose. And so this research found that medication abortion policies in Wisconsin only compound the existing barriers that people experience. As I mentioned at the very beginning about the pandemic-based research related to abortion, this was a poster presentation that I did with those findings. And you can see kind of in this bottom left corner, the different types of access in surrounding states. So, for example, the first one is Wisconsin. At the time, 4 clinics, mandated 24-hour waiting period, the same provider, no telemedicine options, 2 in-person visits were required. Compare that to Illinois, where there are 17 clinics in the area. At the time when we were studying this for the pandemic, hey, so it looks like I got booted out.
Oh, good, you're back. Yay.
Yeah, I'm here. Let me continue. Thank you for your patience. This, we're in a Zoom world. Just now, I swear, Zoom hates me. Okay. So, compare that to Illinois, where there is no mandatory waiting period, and there are telemedicine options that are available. So this is really a state patchwork where every state has different rules and different, and always had, even when Roe was around, always had different rules and regulations about how people could access abortion. Now that's only been compounded with the reversal of Roe. We're now seeing states and areas in this country where there are abortion deserts. That means that basically the entire South is, except for, I think, Florida and North Carolina, abortion is virtually illegal. So we're seeing abortion deserts, and then people are going to be going to states. Illinois, Southern Illinois is going to be one of those places that people from Kentucky and Missouri and Indiana and Ohio, they're going to be going to Carbondale, Illinois, and crowding those clinics. And people in Illinois then are also now going to have to wait even longer because those clinic wait times are going to continue. So as I mentioned, we explored Reddit to see people choosing their options, medication or surgical abortion. Essentially, what my takeaway is from this, from an information access standpoint, is that people aren't able to get the information that they need, or it's very limited, from traditional models. And now there is this great fear in Wisconsin about even having conversations with your primary care doctor about an abortion. People, obviously there's HIPAA and things like that, but people are obviously very worried about even disclosing that type of information to their primary care doctor, that I went to Illinois to get an abortion, or, oh, I'm pregnant, I want an abortion, what are my options? People are afraid to even have those conversations or to disclose that. And so what I have learned from an information access standpoint is that people turn to the internet to look for information, and they're specifically turning to social media platforms to find out how they can choose their abortion options. So in May, I wrote a piece for the Library Journal all about reproductive health at the reference desk, but reproductive health is it's a large concept. It's a comprehensive concept. This was really about abortion. It was just kind of like a witty tagline, reproductive health at the reference desk. It flowed well, but this was specifically about abortion. And so in early May, we had a US Supreme Court draft decision that Roe v. Wade would be overturned. That obviously did happen on June 24th. And so there has been, understandably, a lot of questions and concerns about what librarians can do to provide information, what are they allowed to do, things like that. And so in this article, it really just kind of dispelled the myths about abortion care, and abortion options and abortion access. Since this article has come out, since the reversal of Roe, there has been even more concern about what are librarians able to do. I read an article, which I'm sure many of you did as well, librarians in Oklahoma who were concerned that they wouldn't be able to provide information about abortion. And of course, it's important to note that we aren't medical professionals, we aren't doctors, we aren't diagnosing, we aren't making any recommendations, just like we wouldn't for any other health concern. But this was even specifically saying you couldn't, give a book that had information on abortion or something like that. And so that can be very concerning, especially from an intellectual freedom standpoint, and certainly from an information access standpoint. And it leads me to, this is just kind of where we're at right now. As I mentioned, we have this abortion desert. Florida and North Carolina are about it. So as you can see, people are going to be scrambling to Carbondale, Illinois, to their clinic there. And then here we are in Wisconsin, where that 1849 law is being held. And I also want to say that there was an effort to have the 1849 law taken off the books earlier this year, a few months ago, in early May, I believe, or early June. There was an effort to have it taken off the books. However, legislators gavelled in and gavelled out in 30 seconds to keep the pre-Civil War law on the books. So again, relating back to how does this connect to libraries? So I did a literature review about what type of research has been done about sexual and reproductive health information, and basically in libraries and information. And I looked in 11 different databases, and I scanned many different articles, and basically found that in terms of library and information science, there were 0 articles that have been published about providing sexual and reproductive health information. I did find 38 articles, but they weren't from a library and information lens. They were from community health journals, from communication journals, medical journals, things like that. So specifically, in my experience doing this literature review for library and information science, there are no articles, there is no research about abortion or reproductive health care. So I was looking at articles from other areas. And so that means that there is a lack of conversation going on about this. And so it led me to do my own survey where I sent, and maybe some of you in this room completed the survey. I sent out survey requests throughout the entire US through all different library associations, and I got 179 responses from people who work in public libraries. And it was all about what type of sexual and reproductive health information do you provide at your library and why? Many of them was, select all that apply. Do you provide books, databases? Do you do book displays? Do you have programs? Do you have community partnerships? Things like that. To me, the most illuminating were the comments that I got from people about why they do or do not provide sexual and reproductive health information. And these are some of the opinions from both Wisconsin as well as from librarians throughout the country. There are many comments about, I live in an extremely conservative community, fear of community backlash, we've never done this before, concern about the reception that people would get. Many people were saying, I hadn't thought of this, or people don't ask for this, which makes sense because how often are you going to go up to a reference desk and ask a stranger about, what kind of condoms you should get or something like that? That's not something that you would feel comfortable probably asking a stranger. But just because people aren't asking for it doesn't mean that they don't need it or they don't want it. So that's kind of a big takeaway for me, is that hinging on what people are asking is really a disservice, because people are looking for this information, as evidenced by the Reddit forums where people really have lots of questions and are speaking to total strangers. They just don't feel comfortable at a library. So how can we provide this information through books or through databases and things like that? So I'm in the process of writing a book all about how libraries can do just that. It's set to be published in spring of 2023, and I finished the first draft. I'm now in the revising phase before I send it for final review. But it's going to be all about collection development, community partnerships, thoughtful programs, best practices, and basically about how libraries can fill this gap. This is a really hard time that we're in right now, a lot of confusion about how to proceed, and it's undoubtedly going to continue. That survey was sent out to librarians March through May. So that was before Roe was reversed. I would be really curious to see what those responses would look like right now. But even before Roe was reversed, there's a lot of tension about community perceptions, there were a couple things about people being afraid of what their director or the board felt. All of this hinges on an information access issue. And so I really hope that this book is going to help provide a guide for libraries to provide this information in a way that is thoughtful and equitable, but also will help deepen these conversations that need to be had in our libraries and with our administration. Because this, and I'm going to end this here. This is like one of my last slides, and then I'm happy to take any questions. But I just want to say that this isn't just about abortion. When we're talking about sexual and reproductive health information, it's not about abortion. Gender affirming surgery, for example, is now illegal in Florida under Medicaid. We have 16 states who are pushing don't say gay laws. There is a lot of conversation about what the reversal of Roe means for the future of contraception. And so this is not just about abortion, it is about sexual and reproductive health information on a comprehensive level. And as I've said, it's not just about the services, it's about the information access. If a state is saying you can't talk about certain things in school, that is a huge disservice to information access. So libraries are going to have to fill the gap. Of course, I don't want to misrepresent or pretend that I am naive to the fact that libraries are experiencing higher book bans than we ever have before. All of this, though, is leaning towards information access and sexual and reproductive health as an information issue. So I'll leave it at this. I like to say information, or lack thereof, is the focal point of how we construct our lives. Going back to that reproductive justice framework, we make choices based on the information that's available or not available to us. And I believe that public libraries have a duty to ensure information access for all, and that includes sexual and reproductive health information. So I'm happy to take some questions or just hear some thoughts from you. If you'd like to stay in touch, I would love to stay in touch. That is, those are two ways you can get in touch with me, my website and also my LinkedIn. Thank you so much for having me, for being part of this conversation. I know that there might be mixed emotions about these topics, but I'm really grateful for your presence and for your willing to learn.
Thank you so much, Barbara, for sharing that, your research, your expertise, your perspective. I'm really hearing that libraries play an essential role in supporting access to reliable health information for our communities on a whole gamut of topics. So what we're going to do now is you can put questions right in the chat. You can unmute your mic or raise your hand, whatever you feel comfortable with. We're happy to take those questions now.
Yeah, and feel free to ask any question on mic, chat, just like Jennifer said. Even if you just are confused or don't really know what your question is, I'm happy to hear whatever it is you have to say and perhaps provide some clarity.
I'm also going to throw in the chat a link. Monica Treptow, who was with us earlier, is the school library consultant for Department of Public Instruction, and I'll be dropping a link in the chat to a kind of a frequently asked question document she thought would be helpful about the human growth and development curriculum in the state.
Oh, that's great. That's wonderful. And I'd like to put in the chat, I'm going to put the Guttmacher Institute, which I really recommend for anybody that's looking for information on a state level about all different types of legislation related to sex ed, related to abortion care, related to contraception, anything of that nature. And you're curious how Wisconsin compares to other states or just what another state might look like. The Guttmacher Institute has been around since the late 1960s and is one of the best resources. People on all sides of the aisle, however they feel about abortion, reference the Guttmacher Institute because they do some really diligent research. I'm in academic libraries. However, I'm curious what you would advise to a librarian in a conservative community and afraid to have information. Remind them of the ALA Bill of Rights and their collection development policy. Yes, so that's thank you, Dawn, for that question. And I don't pretend that it's an easy situation to be in. So I just want to say that, first of all, I understand how difficult that would be to just be having, attacks on your collection in general. And I can understand the fear of wanting to provide this type of information. However, I want to say that having a really strong collection development policy is going to help tremendously. I teach classes on serving diverse communities. And one of the key things that I teach is having strong policies, not just about what it is that you purchase and why you purchase this and from where you purchase material, but also how you determine what stays in the collection, what gets weeded, and beyond that, how you handle people who want to have a book taken out of the reconsideration requests, I guess. Having very, very clear guidelines, and then also working with staff to have clear messaging on how to respond to people who may come to the desk to complain. So that's really important. As part of that collection development policy, I recommend having the ALA Bill of Rights as part of that policy, as well as referencing other things like the United Nations, Article 19, and also the First Amendment for freedom of speech. I think that that's really important.
Barbara, I'm curious about the book that you have coming out. Perhaps, I don't know if this will be there, but do you have either resources you can point people to, collection development tools they can use when looking at, reflecting on sort of what their collection might contain, where there might be gaps, you know, anything a little bit more on a practitioner level of sort of how to build a health information resource collection?
Yes. So that's a really great question. The first part of the book is really talking about the key facts about different areas of sexual and reproductive health. And then also and then the second part is how that can relate to library services. So specifically for collection development, it talks about things that you can look out for, like outdated terminology, or concepts that are irrelevant, or ways that you can assess whether a book is credible. So that information is included, as well as a host of evidence-based websites and research organizations that you can go to find other material that aren't just books, but are also digital resources or things like that. Because I do think it's important to not just have books, because frankly, some people, they might not feel comfortable bringing a book home. They might not be safe taking a book home, things like that. Having resource links are going to be really, really important. And so I also include steps on how people can create resource pages for their library, including links that are reputable and that are evidence-based, and how people can assess those types of resources too. And, I got some of that experience when I was at the last public library I was at. I kind of revamped their sexual reproductive health information. We had a lot of books from like the early 2000s and stuff like that. I think like we had like The Joy of Sex, but it was like from like 1982 or something like that. So anyway, it was a lot of revamping things. And the other thing is that I provide some tips in the book about how to actually find these books, because when I had to build up that collection, these aren't books that are going to be in like Publishers Weekly or on the New York Times bestseller. These are like, books on sexually transmitted infections and stuff like that. So you have to like go out and look for them in Baker and Taylor. And so I provide some tips on how you can actually search by keywords, and some books that I recommend that you can add to your collection as well. Yes, see, there you go. And that's a really great point, is that, just in the last couple of months, a lot of books now are perhaps irrelevant. And when they do want a book or a DVD, another argument for self-checkouts. Yeah, there you go. Yeah. Absolutely. Self-checkouts can help provide that anonymity that people may need.
I think we have time for just one more question. And if not, what we can do is thank you, Barbara, for sharing your contact information.
Thank you.
Certainly get in touch with her. I'm just going to quickly take the screen back if I can.
Yeah.
Just to see, just so that you can see some information about our, whoops, what did I do? Let's do this button instead. There we go. So thank you for coming today. Barbara, thank you again. Thanks to Andy for running things behind the scenes. This is an ongoing WiLSWorld Shorts. We put these on periodically. Our next one is October 7th, and we hope you'll join us to hear from our colleague, Beth Tomev at DPI, talking about sort of how to tell your library story and kind of communication, marketing sorts of advice. So we're looking forward to that. But again, thank you, Barbara, so much. Thank you to all of you for coming today. This, I think, has been super informative. You're seeing lots of great thanks in the chat coming through, Barbara. So we really appreciate it. And we're glad you moved north, that you're here.
Thank you, everybody, for taking the time to have me. I'll also be at WLA. So for anybody that's going to be there, hopefully we can meet up. But thank you so much to Jennifer and to Andy and Wills for having me. I really appreciate it. And have a great day. Have a good weekend, everybody.
Thank you so much. Take care.
Bye.